Most people who have had knee pain for a long time, who have tried things that did not work, who are now facing surgical conversations, have started to feel like their body has turned against them. If you've done the therapy, had the injections, rested it, modified your activity, and the pain keeps coming back, is the problem actually in your knee? Or is your knee the place where a problem from somewhere else is showing up? I'm Dr. Tammy Penhollow. I'm a physician specializing in regenerative spine and joint care. Someone comes in with knee pain. They've been through the standard progression and things improve a little, then they plateau or nothing meaningful happens at all. So now the conversation is shifting towards surgery. And when I do a thorough evaluation and exam, I find something that changes everything. The primary driver is not the knee. It might be a disc bulge at L4-5, sending referred pain directly into the knee. The knee is where it hurts, but the disc is where the signal is coming from. It might be significant hip pathology, creating compensatory loading patterns that the knee has been absorbing for years. It might be something on the opposite side, the opposite limb, that has altered how this person walks, stands, and loads their joints. In all of those situations, the knee is not the source. The knee is the symptom. So every treatment focused exclusively on the knee, no matter how well executed, is treating the wrong structure. In some of those cases, by the time we figure this out, the window for certain conservative and regenerative options has narrowed or closed. Not because the treatment was bad, because the evaluation was incomplete from the beginning. Your body's not this collection of isolated parts. It's a dynamic, connected, interrelated system of hundreds of structures, joints, discs, muscles, fascia, nerves, all of them communicating, all of them compensating when something else is not working. That system is called the kinetic chain. And understanding it is the difference between treating a symptom and solving a problem. Stop perseverating on the knee. Be open to the possibility that your body's telling you something is wrong and that the location of the pain is not always the location of the cause. Let me give you the reasons this matters, because the stakes here are real. Reason 1, treating the symptom without identifying the cause produces temporary results at best. If a disc bulge at L4-5 is referring pain into your knee and you inject the knee may feel somewhat better for a period of time, but the disc is still there. The nerve compression is still there, and the signal is still being generated. The pain will return. And the next reasonable question becomes, what do we try next for the knee when the knee was never the problem? I offer a 5-session intensive done entirely over video. We work through your specific situation, your history, your imaging, your pattern, one-on-one in real time. Reason 2, identifying the root cause and treating it produces real results. When the correct structure is identified and addressed, outcomes change. Pain resolves, not temporarily, but meaningfully. People return to activities they'd stopped doing. They return to work. Mood and quality of life follow. Reason 3, continued misdirected treatment creates compounding frustration and compounding cost. Every treatment cycle directed at the wrong structure costs time and money, and more than either of those, optimism. The person who has spent 2 years treating a knee that was not the real source of their pain is not just financially depleted. They're often emotionally depleted. They've started to believe that nothing will work and that their body cannot be helped. That belief itself becomes a barrier to getting the right care. Reason 4, the window for conservative and regenerative treatments can narrow or close while the wrong structure is being treated. There are parameters that determine whether someone is a candidate for all of our regenerative approaches. Disc height is one of them. For using your own bone marrow-derived therapy in the disc application, we look at whether enough disc height remains to work with. Once the disc is flattened, that option is no longer on the table. The same applies to joints. There are degrees of joint space narrowing beyond which the biology does not have enough to work with. When someone just spent 18 months treating the wrong structure, that's 18 months of continued breakdown in the structure that actually needed the attention. Sometimes the difference between a candidate and a non-candidate is measured in exactly that kind of time. Reason 5, unnecessary surgeries happen with the wrong structures being treated for far too long. Surgery is often presented as the next step when conservative treatment has failed. But if conservative treatment was directed at the wrong structure, it was never given a real chance to succeed. And surgery on that wrong structure does not solve the problem. Knee surgery when the driver is a hip problem. Knee surgery when the driver is a spinal nerve. These outcomes are predictably limited because the cause has not been addressed. And surgery is permanent. It removes options. It changes your anatomy. It forecloses on conservative approaches that might have worked if the correct structure had been identified first. Reason 6, getting less sleep from ongoing unresolved pain is not a minor problem. When the root cause is not addressed, the symptoms persist. Persistent pain disrupts your sleep. Disrupted sleep lowers pain tolerance, impairs recovery, affects your mood, reduces the capacity to stay active. That person becomes less resilient to the things that is not being solved. When the right structure is identified and treated, this loop breaks. Sleep improves, pain tolerance improves, recovery capacity improves. Reason 7, less money spent on ineffective treatments means more resources available for what actually works. This is practical, and we're saying plainly. For many people, by the time they arrive at the correct diagnosis, they've already spent significantly on what did not work. Understanding earlier that the knee is a symptom and not the source redirects those resources toward the evaluation and treatment that has a real mechanism for producing change. Reason 8, mood, joy, and daily functions are downstream of this. Hiking, traveling, keeping up with their family. These are not extravagant requests. They're what health is for. When the source of pain is identified and addressed correctly, those things come back. When the source is missed, those things stay out of reach no matter how much effort goes into the knee. Reason 9, thorough evaluation changes the conversation with every other physician you see. When you understand that your body operates as this interconnected system, you ask different questions. You're not just asking whether the knee needs a scope or a replacement. You're asking whether the knee is where the problem lives or whether it is downstream of something that has not been evaluated yet. That question asked early can redirect an entire care pathway. Reason 10, your body is creating symptoms because something is not right somewhere. The location of those symptoms is information, but it's not always the answer. The knee is telling you something. Whether what it is telling you is about the knee or about something it's connected to. Before the next treatment, before surgery, ask whether the knee has been evaluated in context, not just in isolation. In context of the spine, the hip, the opposite side, the way you move. Sometimes the knee really is the source and treating the knee is exactly right. But when the source is somewhere else, knowing that before committing to the path is the difference between results and more of the same. Keep learning. That is always a good next step.